to 11 years old on the 26th. So this is, I think this is just kind of so that you guys know what's coming up to prepare yourselves, because it looks like Moderna, then J&J, and then the 5 to 11-year-olds and the mix and matching. The interesting thing too is the MMWR just put in a report showing that the third dose has a very similar side effect profile as other doses. The first and second dose is very similar. So it's just things you can tell your patients and people who are coming in to get vaccines. So this is just you can have this, you can look it up. Yeah. So now I'm going to turn it over to Miranda Durham to give the update on the booster doses, as we've been giving those out to all of you guys. So thanks for all you're doing, and I'm going to turn it over to Miranda.
Great. So this is just New Mexico booster data, New Mexico specific booster data. So if you look back to August 1st, which is really before there was any recommendation, but that's when we started to see a slight uptick in third doses. There have been 30,000 doses, both the additional ones for the immune compromised and the booster doses, the Pfizer boosters given since 8/1. This is the graph. The blue line is the cumulative, and the green bars are just the vaccines by day. And it's marked here when the 8/13 is when we started with the additional doses, and 8/24 with the booster doses. All right, so yeah, next slide, sorry. Now this is just the boosters given since 9/24, which is when the Pfizer booster recommendation happened. So it's 21,000 doses, a little, I mean, no one knew what to expect. We do have about 70,000 people a week that we think are eligible for a booster. So, you know, a little bit of a slow first week. And next slide, I think, is just looking at the third doses. Again, going back to that 8/1 date by brand. In the state, we have given about 20% more Pfizer dose primary series than Moderna. And you can see this is just the split out of third doses. And the next one is just looking at the primary doses versus the third doses. So the week before the approval, the green bar represents the primary doses and the blue bar, the third doses. And then you can see the drop off in the number of primary doses the week after the booster dose approval, but an increase in the number of third doses that were given. So again, hard to attribute cause to it, but just interesting to see where those, you know, who's getting vaccinated at this point. And I think this is just, again, going back to that CDC graph, but really looking at it just so you can, it's actually a very fun tool, I think, but this is looking just at people who got first doses. The graph we showed before was total doses. So this first doses just shows that kind of nationally, there's the same trend that we're seeing here in New Mexico. And I think with that, we will turn it over to Dan Burke.
Thanks, Miranda. So, you know, there's obviously a lot of moving parts here in this whole vaccine campaign, right? We got the boosters, we're expecting Moderna and J&J. And what's coming up next is Pfizer for kids 5 to 11, which is cool because that starts to get closer towards the whole population eligible for vaccines. So Pfizer announced results from their phase 2 and 3 vaccine trial for kids ages 5 to 11 on September 20th. And they submitted their trial data to FDA on September 28th. So it's, you know, just a week ago. So they're requesting an EUA for children 5 to 11, and they are expecting it. The request will go in later this week, and the expectation is that we'll actually get that EUA for Pfizer for 5 to 11 basically in a month, by the end of the month or early November. So say by early November, we're already in that. And there's some really good news that we're expecting that will be good for providers. First of all, the longer refrigerator storage, like more than double, So like right now, you can go up to a month, right, in the refrigerator. Don't have to have it in the ultra cold freezers. That's going to more than double. So that's really good. Most providers will be able to get it, frozen and just put it in the fridge and use it. Because in 10 weeks you can, or 12 weeks or 8, however many it is, there you'll probably be able to use it. And they're also working with the government to get smaller order sizes, smaller number of vials per order. So now we're at 1170. Many small providers can't handle that size, but the smaller orders are coming. That should be very friendly for smaller providers. Next slide, please. Okay, so this is some of just the study. This is a bit complex, but the study that they gave, the kind of the key things here to talk about is that they studied the 5 to 12 years. They're going to settle on a 10 microgram doses, 21 days apart. So it's a third of the current size for adults. They're talking about, so that's the smaller size for the kids. And the other thing to just jump ahead to is they are already pretty far ahead on the younger kids, ages 2 to 5 and ages 6 months to 2 years. So those are in the wings. We don't know when those timings will be, but those are coming up next at some time soon. And the kids under 5 would be getting a 3 microgram dose. That time as well. All right. So just to touch on vaccine exemptions, we don't have medical or religious exemptions for COVID vaccine. We have them for school. New Mexico immunization program only provides exemptions for for the school requirements for, to get into school. That's all we do. So individual owners need to develop a process for any exemptions that they're going to do on their own. That's not the state. That's not the state's call. And providers may be called on to provide medical exemptions. If people can't get vaccines because of anaphylactic or whatever their reasons are that they can't get doses. So that's exemptions. And just to look at, we're kind of looking back at our 12 to 15-year-olds to see, well, that's maybe some indication of what our 5 to 11-year-olds may look like. There may be a similar pattern. So what we see is we start out with a pretty fast jump, so all the parents that have been waiting to get their kids vaccinated, boom, they get in there in the first, week or two. And so you see that, and then you see things kind of slow down and they sort of, gradually incline up. And so we've been seeing slow but steady progress in our 12 to 15-year-olds. And so we're at 33% of kids, 12 to 15, received at least one shot. So, 5 to 11 might be around there, maybe a little less. Maybe parents will be more protective of their younger kids, you might think. And if we sort of mirror the 12 to the same as the 12 to 15, that would be 62,000 doses for our kids 5 to 11 in the first month. So, we'll see. It's always unpredictable what the demand's going to be, but those are some indications. Okay. Just to remind everybody, to remind ourselves, we still have Hispanics and African Americans are lagging behind other racial and ethnic groups in the 12 to 15-year-olds pretty significantly. And in the next age group, also they're lagging. It's not quite as extreme, but we still have that same pattern. So just to remind ourselves that anything we can do to bring in those groups that need to come up in the numbers and the coverage, we need to do that. So I think
Thank you, Dan.
Yeah.
Yeah, thank you, Dan. I just wanted to share these slides just because HAN came out last week, a health advisory network from the CDC, just updating everybody on the fact that COVID-19, the data shows that it really does cause serious outcomes in a segment of pregnant women. So of all the data that they collected recently, this is in a MMWR that just came out as well, that there were 125,000 cases throughout the United States, And out of those, 22,000 were hospitalized, and there were 161 deaths. So just, I don't know, I think as a family doc, delivering babies and stuff, it's just so sad to think that some moms, some babies lost their moms, and, and a whole bunch of families lost their moms. So just, the data on vaccines for women actually show that only 31% of women are vaccinated nationwide, and who are pregnant. And I think all of us totally get it, like, especially all of those of us who've been pregnant before, like really worried about what goes into our bodies and when we're pregnant. But this study showed that that the vaccine was extremely safe, and actually the risk benefit of getting COVID was just much worse. And so just recommending the vaccine for people who are pregnant, breastfeeding, trying to get pregnant, and might become pregnant in the future. So hopefully those of you who are providers in the community can continue working with your moms and people who are trying to get pregnant, because that is the group that's not getting vaccinated as much right now, including different racial ethnic groups and also pregnant women. So just another advertisement about that. And then I'm going to turn into Liesl, our vaccine community coordinator, to just share with you what updated information you guys can get for sharing in your practices.
Hi, thank you, Laura. So we just want to make sure that you guys have as much helpful information to refer to as possible when you're advising patients. So one of these things is that the Health and Human Services Department created these infographics that breaks down the boosters eligibility by underlying conditions, high risk settings, and then other general eligibility rules. Next slide. Sorry, I think there's a lag. Oh, there we go. So this is a community resource center website that we originally created for our CHWs, and then I got opened up to more of the community partners, and now we're just kind of referring everyone to it. It's kind of a one-stop shop for any questions you have. If you forget where you found an information on the various DOH websites, they're all linked here. So this is just a good place to go to if you're like wondering, where do I find this information? Where's this infographic, and kind of information like that. And these are other infographics that we created. So there's one for each vaccine, Pfizer, Moderna, and J&J. And they just have all the eligibility broken down by whether you don't have your Pfizer vaccine yet, who's eligible. And then if you do have your Pfizer vaccine, who is eligible for what. So if you need an additional dose, if you need a booster, and the timelines for each and the eligibility for each. And then on the back of the flyer has the list of the underlying medical conditions and then the high risk settings. So you can go to the next slide. And these are the Moderna and the J&J ones, which have less information because they're less eligible for things. But as eligibility changes, we will be updating these, and you should be able to find these on the CHW website.
And thanks so much, Liesl, for updating these. We actually got community feedback that said it was confusing to have people figure out Pfizer, Moderna, or J&J. So there's like just now these flyers that Liesl made that just made it super clear, like if you got Pfizer, if you got Moderna or J&J. And can you also share with people the link to being able to get these printed out in your community clinics or your locations, if if you don't have a printer or you have difficulty getting stuff?
Absolutely, yeah. So we did partner with a printer in Albuquerque, and I will share the instructions in the chat of how you would order these materials. You can go and browse our Dropbox, which will have these materials and more materials from DOH available for order. And then you can order them, and you can either pick them up in Albuquerque or have them shipped to you anywhere in the state for free.
Great, thank you. Yes, thanks so much, Liesl. And then now we're going to go back to booster questions and answers from last week that Miranda is going to go over now. So thank you, Miranda.
Yeah, so there were some there were a lot of questions. We did put a document together, and I think it's going to be posted in the Take Care NM website. But I just picked a few that I thought were especially interesting, or that I learned something from tracking down the answer. This one was just the fact that a lot of people want the lot number on their vaccine card. And the person who asked the question, like I did, thought that you couldn't get your lot number off of VaxView NM. But it turns out that you can. You just have to, along the bottom here, there's a couple of choices. Instead of download full record, which would show any flu shot or any other shots that a provider had reported, you download the COVID-19 record and you get a little view that looks just like a Vax card with your lot number. So again, this is the vaxviewNM.org website, and it is the public-facing or the consumer-facing view of NIMSIS, the state immunization database. All right, then the next one, can patients enter their third dose in vSafe? So vSafe is a program that the CDC set up so that patients could monitor symptoms after the vaccine. So patients actually enroll themselves in vSafe. And the CDC did say in meetings that we had last week that vSafe had been set up to capture third doses and to send third dose reminders to participants. So I didn't know that it had a messaging component. You do have to have entered yourself into vSafe, I think within 6 weeks of your last vaccine, but if patients ask, yes, and this is just on the right-hand side, a picture of like the links for getting signed up to vSafe. The next question was, will the 450 dose pack of Pfizer, the half pack, be offered soon again? We had heard that it could be offered as soon as November, but then as Dan said, we heard sort of an inside scoop yesterday that hopefully there'll be an even smaller packaging of Pfizer soonish. So all good news. Let's see, this one, the QR code for vaccine administration, and I'm not sure if this is what the person meant when they were asking, but it does turn out that we will have a QR, so the vendor, the NIMSIS vendor, is working on attaching a QR code to people's vaccine records. So when you go in to get your vaccine record from VaxView, it'll have a QR code that's unique to you, and that will allow you to upload it into various apps like, Apple Wallet and things like that. We can next week have the person who really knows about this better than I do, our immunization program, NIMSIS program manager, come, but this is kind of a sneak peek at what's happening, and we're hoping end of November on this. And I think that's it for the questions. The flu updates, the DOH immunization program has sent out a limited supply of flu mist to VFC providers. For the 317 program, it sounds like flu vaccine has gone out. Just a reminder that flu vaccine and COVID-19 vaccine can be given at the same time, and they can also be separated by any number of days. So it doesn't have to be 14 or nothing. And then there is a CDC digital media toolkit for the 21-22 flu season. This is just one example, the I Get It campaign. All right, next is, and this is just a reminder about the TakeCareNM.org website that does have all the becoming a COVID vaccine provider resources, and will soon be the place that we post like these meeting recordings and Hans and other provider specific information. And just a reminder that medical providers are the #1 trusted source of vaccine advice over and over again in national and local studies. Okay.
And I think, thank you so much, Miranda, Dan, and Liesl. And then we just wanted to end with just kind of, once again, thanking all of you for all you're doing in the community to get vaccines out, getting the COVID and flu out at the same time. I know that's a big lift. What we also wanted to do is that we're starting to put together town halls and local town halls, hopefully in some of your communities. We'd love to have some of you guys be speakers for your local communities. And so our new I think Katie Diffendorfer is on this call right now, but she's our new communications person for doing the town halls and getting a speakers bureau together. So if any of you guys want to be part of that, please reach out to Katie and she can help organize town halls in your community, you know, getting all that organized. So we think that really, like Miranda said, you know, you guys are the trusted provider in the community. And so getting the word out in your community from all of you would be amazing. And I think really get some, I mean, I know people are hesitant about their kids or pregnant women hesitant or certain groups. So just seeing people they know, we hope will help increase vaccine rates. For the primary doses, continuing, thanks so much for continuing to promote and schedule those first doses. The 65 and over and 50 to 64 with underlying conditions. We're actually, I don't know, Chris, you're opening it up now, right? So that like we haven't seen the huge uptake that we thought. So, you know, go ahead and open it up to the other eligible groups, and just making sure you're creating availability in the app if you're using the app for people to make appointments. And yeah, and hopefully we can continue this dialogue, you know, ask your questions. And yeah, that's what we're here for. So thanks again for all you do. And we want to open it up to questions now or comments, or if you don't have any, we can end early. So just wanted to have a space for you guys to, I don't know, interface and have any, you know, feedback around how this is rolling out. So.
Hey, Dr. Patajon, just real quick, we had about 30 people join after the slideshow got started here. Can you just repeat essentially what's coming down the pike in terms of the kiddos and
Oh yeah, for
everything else,
sure.
just for those folks that were just a little bit late?
Yeah, let me, can I find the slide and then just hop back up on here? Okay. Hold on, let me just pull the slide back up of the up and coming info.
Okay.
Okay, so just for those who haven't been on the call yet, here we go. Can you see that?
Yes.
Okay. And is it the slide? Is this the slide you wanted people to see, Chris?
Yes.
Okay, yeah. So this is like the up and coming slides, I mean, of what's coming up. So they're discussing the Moderna booster dose on October 14th, J&J on October 15th. On the same day, on the 15th, they'll also be discussing the mix and match. You know, can you get a Johnson and then a Moderna, or vice versa? And then October 26th, they're scheduling the authorization, the EUA for the 5 to 11-year-olds. So just so people know, it's going to be probably a busy month, you know, as things come online and people get, you know, more access to their boosters or to 5 to 11-year-olds.
Great. Thank you.
Yeah, for sure.
So I'm going to go ahead and Rita, it looks like Dr. Durham got back to your question here about the storage.
I think it's a good question though, which is Rita was asking, like, what about extending the time from when you puncture the bottle? Because that really is a huge kind of, I mean, it's nice that we can extend how long we keep Pfizer or the other vaccines in the fridge, but that's also a real limiting factor too. And it does sound like Pfizer, so as you know, Moderna you can keep in after a puncture for 12 hours. It does sound like Pfizer is looking at, you know, talking to the FDA about an extension of their time from vial puncture, but probably isn't going to be more than 12 hours this round anyway. So it'll help, but.
Great.
Yeah.
Let me see. Daniela, let me go ahead and share, says, when trying to sign up for a booster, there's nowhere on the registration page to indicate that I'm signing up for a booster. Is this something that must be indicated when registering? So we are pulling that in for the providers. Let me just go ahead and reclaim. post here. So this is my information, so I give everybody permission to view it. Can you all see the registration details here? I'm going to
Yep.
assume that's a yes. So under this vaccination history is where the user can add additional vaccines, which will help determine which vaccine they can actually receive. We're also going to be making it available on the provider side. Let me come over here real quick. I got it. I don't have a particular record in here that I can show you all. So on our training on Thursday, we'll look at that. But essentially, the drop down to select which vaccine and the type of vaccine that's being administered is now in your update window. It's the first thing that you as a provider have to select. And we're pulling the patient's vaccine status, so that window that we saw. So if they haven't added any activity, you can go ahead and add it in there for them or instruct them to go in there and update their vaccine activity. But we'll take a look at that in depth on Thursday. Okay, great. Any other questions, team? Going once, going twice.
Hey,
All right,
Chris?
DOH folks, if you guys have anything else, we can go ahead and close out the meeting.
Okay, and then will you have the link to the PowerPoints on the I guess on the Take Care New Mexico site?
Yes,
And
so
questions? Okay.
if you guys go, see, I was looking up what is an NGO. If you go to Take Care NM and click for providers, there will be a yellow banner up at the top that this meeting update will update to today. We'll post the video as well as any PowerPoints. I'm not sure if we need to collect any Q&As, but if we need to, we can also post them here. So we'll have all of the meetings in a repository for everyone here.
Oh, thanks. That's great. Thanks so much, everybody.
Awesome. Thank you, guys. We'll talk to you all next week. Bye-bye.
Bye.
Thank you.
Thank you.